Thanks for joining us today on NJ Press Pass. Today's episode, Calling the Shots, focuses on your questions about the COVID-19 vaccines and how to get them in South Jersey. We are taking your questions live. You can pop them into the comments, and they will be answered by our panel of experts. With me today is Caryelle Lasher, communicable disease investigator for Camden County's Health Department. And she's going to help us how to understand how to acquire the vaccine. She oversees the county's large vaccination site. And we have Dr. Kanad Mukherjee, a family medicine doctor with Rowan Medicine, and he oversees the medical facilities vaccinations clinic. And my colleague, Jared Safran, he is based at the Burlington County Times in South Jersey. He is our Southern New Jersey regional vaccine beat writer for the Burlington County Times, Courier Post, and the Daily Journal. Thank you for joining us, experts. Glad to have you here.
Great to be here. Thank you.
We have so many questions from people already. They've been coming in. I've been asking people, what must you know about the vaccine as you wait in line to get it? So we have a lot of questions that came in. Again, we are taking your questions in the comments. I think we may have some already coming through. But before we start taking viewer questions, I want to go to Jared. You've been writing about this so much. Could you give us some of the basics of who can get vaccinated right now and what's important to know before you go to any clinic or your doctor?
Yeah, well, thanks for having me, Carly. The most important thing to remember for people in New Jersey is don't just show up to a site. Everything is appointment-based right now, whether you make it through the state or through another portal. Everything is appointment-based, so make your appointment before you actually go to a site. If you go to a site and just try to get a shot, you're going to be wasting your time. So that's the number one thing to know. As far as who's eligible right now, healthcare workers were the first group eligible, and they remain eligible. The process is still working through them. Police officers, first responders, firefighters are all now eligible, as well as essential workers. And then anyone over 65 can get a shot. And then anyone from age 16 to 64 with a chronic, and that's Governor Phil Murphy's word, medical condition. And that can mean diabetes, it can mean obesity, it can mean a variety of different things. But those are the groups that are eligible right now. We're not at the general population point just yet, but more and more groups are becoming eligible.
Yeah, and that it was important for us to get into the conversation and answer your questions now before the general population is eligible. Jared, what from your reporting has really stood out to you? I mean, you've been at vaccine sites, you've talked to individual people, you've talked to officials. What are some things, is there an individual story, some kind of medical facts that really stood out to you so far in the, I guess, has it been 2 months that you started this beat?
Yeah, almost. So the first thing, because I do think there are still a lot of people out there, you know, some polls have it as almost half the population, who really aren't sure about getting vaccinated and about this product in general and what it might do to you. I've seen probably upwards of 50 people at this point actually take shots and then sit in the waiting area. And I have not even seen so much as or heard about, because you can't always see a side effect, but I have not seen or heard about so much as a side effect, let alone an allergic reaction or something more extreme. So based on the anecdotal evidence that I can offer as a reporter, the vaccine seems perfectly safe. So that's number one. Number two is that the process, you know, this is the largest and most unprecedented public health effort really in modern history. And it's not the smoothest process just yet. The state of New Jersey is saying that they need more doses from the federal government. There are people who are saying that the state is not using a lot of its doses. The mega sites are up and running, but they're only doing really a fourth or a fifth of what they are capable of on a daily basis right now. County sites are opening. Some ShopRites are doing it. Some Walmarts are doing it. Some sites are opening and then doing some vaccinations and then not doing them anymore. So it's not the smoothest process right now. It's almost like everybody is figuring this out as they go. Right.
So, Doctor, I think it's worth explaining to people, just getting right into it, which vaccines are available in our area, especially your clinic, and kind of a brush up on how they work in our bodies.
Sure. So there are 2 vaccines that have currently been approved or emergency use authorized by the FDA, the Pfizer vaccine and the Moderna vaccine. The Rowan University School of Osteopathic Medicine gives the Moderna vaccine, whereas other sites may provide the Pfizer vaccine. The 2 vaccines are nearly identical, but there are some differences that are worth mentioning. The one important difference being that the Pfizer vaccine can be given to teenagers 16 and individuals 16 and above, while Moderna is only for 18 and above. Both vaccines work similarly. There's something called mRNA, which is one of the building blocks of the way sort of the cell makes and produces things for our body. Both have mRNA technology, which has been around for a while for other uses, but has recently been introduced into the vaccine arena. The mRNA for both Pfizer and Moderna code for something specific called the spike protein, which is how the coronavirus sort of attaches to a cell and enters. But both vaccines are injected into the arm, into the muscle, and then the cells in the body will take up the mRNA, which is what normally happens, but doesn't enter the nucleus, but sort of helps the nucleus and the DNA sort of code for that spike protein, which is how the body sort of mounts its response. And they both work in that same way, which might be different for the Johnson & Johnson vaccine, which might get the similar kind of approval in February or March.
So can you also explain just briefly the new strains that we're seeing? I mean, that is really kind of blasted onto the scene in the last week or so, the UK strain, I think the other is Brazil. Can you tell us that? And then in terms of the vaccine, could there be any changes? Could there be new versions of the vaccine?
Sure. The Moderna CEO came out, I want to say earlier this week, and there are some studies that suggest that, you know, it hasn't been tested on humans yet, but like in a lab, that the Moderna vaccine and actually the Pfizer vaccine are helpful for the UK variant and the South African variant and the Brazilian variant. But it hasn't been tested in humans yet, but in the lab, it's been helpful. And it does reduce the effect of the coronavirus in the variant strains.
So with the vaccines, we're not talking about total immunity all the time, but this could also really reduce your risk of, serious complications.
Yeah. So it's important, I think, for everyone to know that the vaccine doesn't prevent you from actually getting COVID. What it does is prevent you from either having symptomatic COVID, which could be mild, and it prevents you from having severe COVID. So getting COVID is not prevented by the vaccine, but to the extent you may have it is what the vaccines do. And in labs, it's been shown to be helpful for the variants as well.
So I have a Haddon Township nurse. She sent us a video. She works at one of Jefferson's hospitals in South Jersey, and she actually explained to us why she was desperate for this. She told me earlier that she actually had COVID in May, and the aftermath of what she experienced since May is still lingering. So I just want to play her comments. I know there are some comments already coming in on the live feed of people saying I'm absolutely not getting it, but I do want to just play what Amanda Sinelli has to say.
Hi, I'm Amanda Sinelli from Haddon Township. I'm a registered nurse. I received my vaccine this month. I received the vaccine because I believe in science, and I believe the only way to end this pandemic is for the population to be vaccinated against it. I am a COVID survivor, so I did have some side effects, which included fever and flu-like symptoms and body aches for about 30 hours. But after the 30-hour mark, I felt fine, and I am ready for my second dose.
Great.
So I think what she said really interesting there is that she had COVID. So then is that linked to increased side effects if you've already had it?
So the studies from Moderna and Pfizer didn't specify whether someone had COVID or not, but it's plausible that if you had COVID previously, that you could have maybe worse side effects, but that's not what I'm seeing in the vaccine clinic where we've vaccinated like people that have had COVID months ago.
So tell us actually what your vaccine clinic is like. Caryelle, I want to know about yours as well. But doctor, just tell us who you're serving there, how many people have come through since it opened, and kind of the demographic.
Sure. So we've been open since Christmas Eve when we received the Moderna vaccine, which is when a lot of sites that got Moderna were starting to open. So it's been about 4+ weeks. We vaccinated over 6,500 people, and we're really proud of that. Initially, it was just phase 1A, which was healthcare workers, anyone that sort of had patient-facing, patient-forward activities. And then the governor expanded to police and firemen, I would say the first week of January. So we've been accommodating them. And then sort of the floodgates opened when the Trump administration and then the Governor Murphy approved 65 and older and 18 to 64. So since those have all been approved, we've been vaccinating anyone in the state and those in Camden County that fit that criteria. And we're about to cross the 7,000 vaccination threshold by the end of tomorrow.
Wow. So I do want to just share something before we get into Caryelle, and this is something that I just want to bring up. She says, my parents fit all the categories, 75, cancer, heart disease, obesity, and still can't get an appointment. Even in the future, what do? They are registered with the state. So she just sent that in. I wanted to address that immediately. Do you guys have any tips there? We are going to get into this more thoroughly in a little bit in the broadcast, but I just want to address that right off the bat. It seems like that they are in need.
I would say look for local options if there are any, but at this point there may not be, and really all you can do until more doses are available and more appointments become available is wait, unfortunately.
Right. So, Caryelle, this seems like a desperate plea for a vaccine. Are you seeing that among the people you serve in Camden County, that people really want it? I'll just reiterate that in the comments, a couple people have said, like, I don't want this. But is that what you're hearing? Are you hearing more do than are scared?
Right now, we've had a really wonderful response to the vaccine. We right now have about 65,000 appointments made already, and they are booking out until the end of the summer. What I would like to say to that person and to anyone who meets the category 1A or those priority groups, definitely keep looking online. They can go to our website and go to register for the vaccine, and just checking for appointments that are available. As they open up, people can get them. They may be long into the future, but as we're getting more vaccine, we'll be opening up more appointments, and then we'll be sliding people forward based on need and how pre-existing conditions, age, and vulnerability. So I do encourage people to keep looking there. My understanding is with the state, they'll be sending out emails to everyone who has registered when there is appointments available to the sites nearest them. So hang tight and wait for that. But I agree, look for local options, our site being one of them.
So on the point of seniors, Caryelle, you and I talked about this the other day because I had several people reach out and say, I'm trying to help my elderly parent get enrolled in this. And you had some thoughts and efforts on behalf of Camden County to, this is a very web-based, I mean, there's the phone line now, but it's been a very web-based way of getting in the queue for it. So, you know, if anyone's like my own grandmother, it took her, computers were never her thing. So what is being done at the county level to assist?
We have a hotline available for anyone who needs help registering online, and that's 1-800-999-9045. And they can give a call and we'll register people that way because we understand this has been difficult. We're also reaching out to our senior living complexes and working with them to get their residents and registered. But just a real call to action for everyone who is good with a computer. Check on your loved ones, check on your neighbors, check on people that are eligible for this vaccine while you wait for your turn, and see if you can help them get registered. Start that conversation about the vaccine, and if you have any questions about vaccine safety or efficacy, you can check out our website or go to the CDC, or of course, consult with your primary care physician.
Great. So Caryelle, tell us about the Camden County sites and who's being serviced there and the success, or, you know, as far as how many shots in arms already.
Great, thank you. And I want to say thank you to Rowan as well, because we worked with them and while we were setting up our planning, and they were really just instrumental in making it a success. Really can't take all the credit for that, but it has been really a positive, successful experience. Right now, people can, of course, sign up online, register their e-check-in. If they're unable to e-check-in, they can do that at our site. The process has been very smooth, and right now we are working under capacity. We do have the availability to take more patients as soon as we get more vaccine available. Right to date, we've vaccinated about 6,200 residents and people in our area. We're hoping to see that increase in the days and weeks to come. We'll probably be closer to about 7,000 by the close of our session today.
So I do want to share a message sent from our member of NJ Press Pass Insiders. That's our Facebook group for the show. You can search it up and join. Mark Eckhart from Cinnaminson, he sent in some thoughts. He is, I think, scheduled next week to get his shot, and he told us why.
I'm Mark Eckhart from Cinnaminson, New Jersey. I have my first scheduled shot next Thursday. Looking forward to it. I'm 63, diabetic, and a 23-year veteran of the pharmaceutical industry. So I have a great deal of faith in Project Warp Speed.
So I just thought that was interesting, and that goes, I think, to Ro, who commented, you know, in getting her parents something. Hopefully that's a little bit of hope. He has his coming up, and, you know, he has conditions as well that he was willing to share with us. Gina McMaster from Franklin Township asked that we explain to people the CDC's recommendations for quarantining for exposure between someone in your home versus someone out of your home. She says, I can't tell you how many times I've had to explain the timeline where that getting tested a few days after exposure doesn't mean you're in the clear. I do want to go over that. I thought that was an important point. And also jumping into what you're expected to do to continue to protect yourself after you do get your shot. Doc, could you take that on?
Sure. Yeah, so there's a lot to that question. It's actually not as simple as the question that was asked. So, you know, there's quarantining if you've been exposed to somebody, quarantining if you've been out of state, et cetera, et cetera. So it used to be 14 days. There are some reasons that should still be 14 days, but now the recommendation is 10 days quarantine or 7 days if there's some testing involved. I also want to make a quick comment about the testing. So there are two types of tests. There's the rapid test, and then there's a PCR test. The rapid tests are only helpful if you are already asymptomatic and it confirms that you are negative. If you have symptoms, a rapid test that is negative doesn't really tell you much. The gold standard test is the PCR test, which is often when they pleasantly stick the swab up your nose. That is a more confirmatory test and picks up people who don't have symptoms but have the virus, or those who do have symptoms and have the virus. So to answer that test piece of the question, it really does depend on the kind of test. Like I've seen all these rapid COVID testing sites, and I'm pretty sure most of them are rapid tests, and they're only really helpful if you don't have any symptoms to start with and confirming that you don't have the virus. So that's sort of that part of that question. And maybe the broader point of, if you get the vaccine, now what? So, if the data on both Moderna and Pfizer haven't revealed itself to prevent what's called asymptomatic spread, meaning you may harbor the virus, you don't have any symptoms, but you may give it to somebody else. In all the medical science that sort of I've learned in medical school, there should be some protection in asymptomatic spread, but they're studying that currently, and they're going to release that data once it becomes available. But if the vaccines, both Pfizer and Moderna, and maybe Johnson & Johnson and whatever else is available to the US and the world, prevent asymptomatic spread, then the world will look a lot more normal than it did before. Or also, if enough people get the vaccine, what's called herd immunity, that's another way that the world will look more normal and familiar that we're used to. So that's sort of the second part of, once people are vaccinated, then what? It is possible to get the vaccine and potentially provide or give the coronavirus to somebody else, even if you don't have symptoms. But that data hopefully will come out and prove that it prevents that. And that's one of the many things that I and everyone else is looking forward to reading about once that data is published.
So that kind of goes to another question from Joe Allen. He's in Gloucester Township, and he says, how long do they think the vaccine will last? We kind of estimate a 4-month immunity after you're infected. So will that be the same for the vaccine?
So I can answer this, but I'm happy if someone else wants to jump in. I don't like hearing the sound of my own voice, but
but we do, so that's what matters.
So there was actually a study that was published in the journal Science earlier this month, and there are 3 types of immunity that we're looking at. The obvious one that I think most people familiar that aren't science people know are antibodies, and that's what the vaccine makes. There's also things called B cells and T cells. I'm not going to try to get too technical about them, but antibodies have been found in COVID patients at the same level or about the same 8 to 9 months later after initial infection. And then the other parts of immunity, B and T cells, they are helpful in sort of another response. T cells sort of help ID the virus and then can potentially kill the virus, and B cells are memory cells that can make antibodies when needed. And both of those cells specific to the coronavirus response are at levels ready to sort of do their job 8-9 months out. And that's important because the vaccine itself sort of works in a similar way. So if patients that had the virus are having immunity 8-9 months out, we're hoping that the vaccine will work the same way, if not longer. Moderna CEO, in some kind of shareholder meeting with I don't know who, said a statement that they anticipate that the vaccine for Moderna will at least last 1 year. Also, obviously, we don't know if that's true yet. The data hasn't bared out. But for people that had the virus, they continue to have immunity in multiple different ways. And that gives us hope that the vaccine will work in the exact same way.
Great. So Renee Pelling, she just wants a reminder on what that phone number was for the hotline. Is that right? 1-800-999-9005?
9045.
9045. So again, I'm going to type it right into the comments for you. 1-800-999-9045 is the hotline. You'll see I just popped it in the comment for you guys. Renee. So we do have a couple of new comments here. Laura Zugi asks, how can I get the vaccine in Camden County? Very basic. Go ahead, Caryelle.
Great. There are a couple sites available online, but to get a vaccine at the Camden County site, as long as you're eligible, being in that 1A or the priority groups of 18 to 64 with a pre-existing health condition or 65 and older, they can go to camdencountyvaccine.com and follow the links to sign up for a MyChart account, and then from there, schedule the vaccine.
I can follow up too for our site. We have a website, rowanmedicine.com/vaccine. We don't have the same capacity as the mega sites, but we have appointments for basically 1 week ahead. They go quickly, so it's important to check that website sort of vigilantly and frequently, but people have been getting in once they found an appointment. So rowanmedicine.com/vaccine.
So, and I see Cindy Worcel in the comments says she had a little bit of a frustration. She said I was told that it was time to schedule my appointment and couldn't type in my info fast enough and my time slot was gone. And I know that that's kind of been a common frustration among people. I mean, it seems like you have to be very diligent, and it kind of, I mean, not to minimize this, but it kind of reminds me of the days when you had to like keep calling for concert tickets. It's the same kind of thing, except even more important. You know, has that come across to you, Caryelle, as something that you keep hearing? You know, these things just go so quickly, and does that speak to the demand?
Absolutely. That is common feedback that we're getting, that the appointments are going quickly. And I do encourage everyone, one, to look at other options like their own site, and then two, just keep trying back throughout the day as appointments become available, either as vaccine becomes available or as people cancel or reschedule their appointments. Those slots are opened up, and everything, it's a live kind of dynamic process. So as those appointments become open, they're available. So just keep checking back and trying to sign up as they become available.
So what's the actual process? You have your appointment finally, you show up. So from the time you get to the Camden County College site to the time you leave, what do you go through? How long are the waits usually? What do you need to bring with you? And just what can you expect? Because I know you have to stick around for a little while.
Absolutely. So when you show up, have your smartphone available if possible, or if you printed out your e-check-in information. If you don't have either of those, don't worry. We have people on site. Those will just make the process go a little bit more quickly. You want to show up with that and an ID, just a regular state-issued ID. We're not looking for places of employment, but just to confirm who you are to your appointment. They'll show up. There'll be a brief health screening. We just want to make sure everyone who's coming into the facility is well. After that, we'll e-check you in either with the barcode, the QR code on your phone, or someone will help you through that process if that's not available. Then you're sent to a kiosk with a nurse or a scheduler to make an appointment for your second dose. I think that's really important. All of our patients are receiving their second dose appointment on site. And then you go for your vaccine. If anyone has any history of an allergic reaction to any kind of either vaccine in the past or food allergies or contact allergies, we do watch them we observe them for 30 minutes. Otherwise, it's a 15-minute observation, and then they're free to go. There really has not been any lines or long wait times. So the whole process takes anywhere between half an hour to 45 minutes, including the observation.
So I'm glad you brought up previous reactions to food and other medications. Karen Spring, she's in Deptford. She asked us previously through the NJ Press Pass group. She says, as someone with anaphylaxis from a food allergy who also used to get very sick from the DTP vaccine as a baby, should I go to my doctor's office or a healthcare facility for this vaccine as opposed to a massive vaccination site? So that might actually be something for both of you to weigh in on. Kind of hit that a little bit already.
Sure. I think the answer depends on when she might be eligible, because part of when the vaccine goes to a doctor's office might be different than when it goes to a mega site or a site like ours. So that's maybe a practical response. But sort of to answer her question, if she has the ability to get the vaccine now, I think going to any facility, our site or the Camden County mega site or any healthcare facility is the right move, because there are many people like myself, EMS, EMT, other first responders, other physicians, other nurses that are sort of monitoring and observing people to ensure that they're not having any responses. And if they do, we have the things necessary to treat them here, or if they need to go to a higher level of care, sort of moving them in that direction. But there are physicians, nurses, first responders on site to sort of, address any issues that happen if they do.
Absolutely.
I just want to share quickly. Colleen Robinson says she went to the Camden County College site for hers. Well-oiled machine, easy, professional, caring. So I just wanted to share that her experience so far. Jared and I have been writing about the effort to move teachers up in the lineup. We had a story, I think it was last week. Time is like eluding me now, but it was either last week or the week before, about municipal officials, county officials pushing for that. Jared can kind of fill in the gaps there. Go ahead.
Oh, yeah. So a lot of officials, especially in our counties in South Jersey, Burlington, Cumberland, and even Camden as well, view teachers as like the key to this process, because if you get kids back in school, you can get a lot of parents back to work as well, and it just has this ripple effect. So they've been calling for teachers to be moved up, really kind of to think of them as essential on the level of police officers, and what they are to public safety is what teachers are really to getting everything moving again, both for kids and for adults.
Yeah, so that's something I'm actually working on something for next week about teachers. One of the questions I have for you, Doctor, is it worth teachers getting the vaccine when they are, and maybe worth it is not the right word, but what can they expect, I guess, if they are one person in facing 20 to 30 kids who are already very germy, depending on their age, but being faced with them, and what can teachers, even when they are vaccinated, expect maybe their school life to be like? I mean, still masks, still barriers. Are they going to be outnumbered by a lot of germs?
I think there's a couple ways to look at that. First of all, I want to shout out one of my best friends, Kimberly Dickstein. She was New Jersey State Teacher of the Year last year, and she's working in person in Haddonfield and at home. Not that she'll see this, but I wanted to shout out that I have a lot of friends that are teachers, and they ask me about this a lot. So, there are many teachers who sort of fill in or fit in the 18 to 64 with chronic medical condition criteria. So in that aspect, they can sort of find an alternate pathway to have been eligible for the vaccine. And I'm all for teachers getting the vaccine. But there are a handful of teachers that, fortunately for them, don't have chronic medical conditions, but are rightfully concerned about, either going back or being in the classroom. And what I will say is that we know the vaccine protects the person who receives it from either having symptomatic COVID or severe COVID. So I think it's like, if the teacher wants a vaccine, he or she should get it. And other states have prioritized teachers too. So I feel that New Jersey, either is moving them up soon or they should be getting it. I think depending on what age the teachers teach, the Pfizer vaccine is for 16 and 17-year-olds. So it's possible that a classroom with Pfizer vaccinated students and the teacher being vaccinated is the ideal scenario for now. So that's sort of one potential scenario. But I think that a teacher, if he or she wants the vaccine, should be able to get it. And they also sort of might have separate eligibility by having chronic medical conditions. So I think the future of classrooms might be some hybrid version or, shields, what I sort of see now through my friends that are teaching. But everyone that's eligible for the vaccine getting it is sort of how everything looks normal again. is how I would answer that question.
I mean, I think it's clear to most people that just because you're vaccinated or those around you are, diligence can't go away. And I think that we have another question from Joan Ballard in Gloucester County. And she says, I've seen several reports that you can still infect people even if you get the vaccine. She says, are you only protecting yourself or will you still need to wear masks? Is that true? And it seems like that is true. I mean, that's kind of where
for now.
Yeah.
Yeah.
I like hearing for now. That's very hopeful.
Yeah. I'm hopeful too that there'll be some reduction in asymptomatic spread, which I think is the silver bullet out of all of this. Plus everyone getting the vaccine, obviously. So it's true technically that if you get after the series, so for Pfizer, the series and your peak protection is like day 30, I think, if I'm not mistaken. And then for Moderna, it's day 42. Yeah, 6 weeks after the first dose. As of now, all we know is that it protects you from getting getting symptoms from COVID or bad COVID. We don't quite know yet if it you can't spread it to others, but I'm hopeful that the data will bear out in that fashion.
Okay.
One thing I've been hearing from some people is that they've been having trouble making second appointments.
Sure.
So let's say it goes past the 21 days or the 28 days, and you still haven't had another appointment. Is the vaccine still working? I think people want that. Yeah. Residents in New Jersey want that clarified for sure.
Yeah. I think New Jersey and the entire world also are interested in that answer.
Yeah.
So, for Moderna, the vaccine was studied in a pretty broad window, really as early as day 24, as late as day 35 is sort of the range that Moderna can work, although the study looked at 24 to 32. And Pfizer sort of has a similar window of like plus minus a certain number of days. The ACIP, which is one of the medical bodies that sort of does an immunization best practice, had a meeting, I think yesterday or Tuesday, where they said sort of the upper limit for both vaccines, the latest should be day 42. So that is sort of the ceiling you can work with if you find yourself in a precarious situation where you can't get the vaccine. And both Pfizer and Moderna have this point of, even if you're out of day 42, to not restart the series just to get the second dose. I know both of them are looking at different timeframes for further data that's going to come out. So we'll have more answers then, but sort of the upper limit of the last day would be around day 42 per the ACIP.
Okay. So I have a question coming in from Rena. She says, what if we received the vaccine in another state, but we've moved to New Jersey and are due for the second one? This is actually the second question that came up in the comments about moving into New Jersey. I think somebody else said that they came from California. Is that going to be problematic here? Caryelle, could you answer that one? Do you know?
Sure. Right now, we are not scheduling people for second dose only. However, we'd be happy to talk someone through that process. I would recommend anyone who is looking for their second shot, anyone who got their first vaccine through registering with the New Jersey registration system. There is, I think it opened up maybe yesterday. They'll be sending out information on second doses this weekend. They're recommending that if anyone has any questions to call Monday. I do have that number as well. But if there's any specific questions on that, we can help walk those people through that. And again, the state is a great resource, and that's a 1-855-568-0545.
Okay, so I also just want to hit, and I think we went into this a couple minutes ago.
So, Carly, can I add something?
Absolutely.
For both Pfizer and Moderna, there is data saying there's some protection after your first dose, so it's not like you're totally left, out to dry. But the second dose should be a priority. I just wanted to make sure that if you received your first dose and you're scrambling to find a second dose for circumstances, you still have some protection, but it's still a priority to finish the dose series out.
Okay. So I just want to reiterate quickly, Mia says, what identification do you need to get the vaccine? Her grandmother does not have a driver's license. Caryelle, I think you went over that a little bit. What is needed to come to the Camden County College site and make an appointment there? Can you just run through that one more time?
Great. Yeah, we're just trying to make sure that we're verifying that we have the right person for the appointment. So if there's any kind of ID, a passport, a government issue ID, even maybe like a medical card, just something with that person's name on it that we can confirm that we have the right person for the appointment.
Okay.
Same at our site too.
Great.
So the same at our site.
Okay. So Marie Flynn in Gloucester County, she wants to know about the vaccine's impact on fertility. This is something that I've heard a couple times going around. We actually had a pre-show discussion and it came up. She said, my daughter's physician told her not to get the vaccine because it causes infertility, and then tried to sell her vitamin supplements. Maybe there's something else going on there. I can't find any information to support this. Her gynecologist says it has no effect on fertility. Do you have information concerning this? So, doctor, you have to be the tiebreaker here between the family med and gynecology.
Yeah, to the poster, I don't know if your daughter's physician that tried to sell vitamins is trained in OB-GYN, so that's maybe one thing to consider with maybe what their scope of training is. But so as of now, like there's no data saying that it does or doesn't affect fertility. Where this sort of idea started coming around was there is one protein that is similar to the spike protein, which is what the vaccine works for, and sort of some leap there is sort of then it causes infertility. The analogy that I have is, and one that I've seen, it's not my original, is that just because my phone number has a number of 7 and your phone number has the number 7 doesn't mean they're the exact same thing. There are similarities, but not enough to sort of cause the chain reaction events that would cause infertility. And in both the Moderna and Pfizer studies, people in the vaccine arm got pregnant. So there's some data that anecdotal part of data suggests that it may not happen, but it wasn't completely studied. But just because someone says something doesn't mean it's always true. But I want to point that out.
So I know neither of you are with Inspira, but Inspira, we did report that they had a problem getting some vaccines. Appointments were canceled, and in the comments, it's come up multiple times now, people saying, what do we do? They haven't been rescheduled. Do you think that they're just going to be kind of back in the regular queue? You think they're going to be trying to come to the Camden County sites? And is this just a part of the difficulty of such demand? Caryelle, do you have any thoughts on this? I mean, I know that you can't speak on what's happening in Inspira, but I mean, just like the demand of this, and what do you think is going to happen to these people?
Right now, demand is high. Like I can speak just for our site alone. We've had over, like I said, 65,000 appointments made. And you can just see that there's, from the comments and our feedback, is that people are continually trying to get an appointment. With this, I'm hoping that vaccine will become more readily available and that we will get more notice on when the vaccine will be coming to us. So hopefully, not just Inspira, but for all sites, we'll be able to schedule, if there needs to be changes in appointments, that will be done with plenty of time and that they'll be able to be made up. I can't speak to what is going to happen with those appointments, but I've been making the recommendation that people go ahead and sign up at the state and then also with ours. And as soon as an appointment becomes available, go get the vaccine at the nearest and most current, as soon as you can, and then just cancel any other appointments available. So I don't know what's going to happen, but there are other options, Rowan and ours and others locally.
I think it's important to also, for those that receive the first vaccine at Inspira, to know if they're going to another site that it's the exact same vaccine. I think Inspira had Pfizer, if I'm not mistaken. So getting a second Pfizer dose is what should be the goal, and not every site has Pfizer. Like we have Moderna only. That's sort of something I want to add to that piece.
Okay, I think that that's a really great point. In this, panic to meet your second dose deadline. Make sure you're getting the correct matching set there. Yeah. So it's also come up a couple times. It seems like people in our comments are very concerned about their elderly parents, grandparents, and specifically a question came up. Is there anyone to contact for elderly to be vaccinated at home? If they're unable to leave their home, maybe they're not in a facility where they're going to come around and get it. Is anybody doing, doorstep vaccinations? Is that going to be part of any plan that you know of so far at your sites?
For our site, we've been, that's been a conversation, is having mobile availability of vaccine, not just for home, but also for perhaps on site at senior living or at some kind of congregate living sites. That has been a conversation, but right now it's really dependent on vaccine availability. We're looking right now to kind of reach the most people we can as quickly as possible, and that would be through our large sites and sites throughout the county. I think when vaccine becomes more readily available, that would definitely be our next kind of phase or conversation to have, is looking at those people that do have different mobility issues, and either arranging for vaccines to come to them or transportation options to one of the regional sites.
Yeah.
So go ahead.
We've had internal discussions too about same kind of, maybe like some kind of truck or something similar to home visits. But part of the issue is sort of vaccine supply and the type of vaccine. Moderna and Pfizer have different storage requirements, and the Johnson & Johnson vaccine that might come out in the future has more favorable ones. So that sort of plays into the decision about the supply chain and the practicality of that. But we're having similar discussions too, and some of it's just dependent on the type of vaccine that is available to do that, because not all of them sort of lend itself to that kind of visit yet.
So the number one question coming into the comments sections right now is, here's my stats. Am I eligible? So what is that a hotline question? Eligibility.
If they don't have access to the internet, absolutely, they can call and we'd be happy to walk them through that.
And that number is 1-800-999-9045.
Yeah.
That should, if you're looking at the comments, scroll up. We have the hotline already in there. Otherwise, online, we'll give you both of the websites for the Camden County site and the Rowan Medicine site. Go ahead and give those again, guys.
CamdenCountyVaccine.com.
And then rowanmedicine.com/vaccine.
I'm putting these into the comments now for you, so you can pull them up. That's going to be the best way to get individual eligibility information for both of their sites. Jared, is there anything else that you can add about how people can find these and determine if they are in this first wave of vaccinations?
Yeah, I would recommend the state COVID headquarters online as well. I don't know the exact web address off the top of my head, but if you Google NJ COVID Hub, you'll be able to find it pretty easily. And then the state phone line as well, 855-565-0545. I hope I'm getting that right. But they can walk you through eligibility questions as well. It's heavily staffed, more than 250 people ready to take calls from all over the state.
Okay.
And pretty much any relevant question that you have about the process can be answered there also.
So we will have And we actually already have tons of information on our websites. Jared and I both provide stories for the Courier Post, Burlington County Times, and the Daily Journal in Vineland, as well as other Gannett newspapers in the state. Jared has extensively written about this for the last 2 months or so. So we will actually have a file. I think he has some links already that we will link up that it has the state phone number, state websites. We'll add Camden County Health Department's website, as well as Rowan Medicine. I see some folks asking for that now. Also, if you join NJ Press Pass Insiders, it's a Facebook group. We will just load you up with all the information in there. That is kind of the follow-up group to talk about what we have here. That's the direct way to communicate with me, pitch different shows you want us to do, and also just, be a part of our show. That's how we had some comments come on earlier, some videos. That's how you can stay the most involved. So that's NJ Press Pass Insiders if you search that up on Facebook. I just want to go over, we're nearing the end of our hour. I just want to know some final thoughts from the three of you, just the main takeaways from your area of expertise. So Jared, I just want you to go first. When we end this conversation, in addition to all of the websites and phone numbers that we have for people, what is the takeaway today?
I think it's to stay patient. There's no target yet, no target date yet for the general population. There's certainly no target date for a full reopening just yet. Everyone is figuring this out. It's an unprecedented situation. I would advise people to stay patient, go online, figure out what you can do right now, try to do it. Also educate yourself about the vaccine if you're on the fence, and do what you can do right now, and then stay patient.
How about you, Caryelle? What is your takeaway, that the number one thing that folks should think about today?
I do appreciate the call for patience, but we do recommend now's a good time. Like I said, reach out to your parents, anyone in the community that may have a hard time working with the computer, internet. See if you can help. You can talk them through over the phone or sign up for them. We're happy to do it at the hotline provided. Any questions for those folks? Of course, there's also the state hotline. And then it's promising that the vaccine's here, but it's not our only solution, and it's not going to get us through this by itself. We still need to remember to social distance, keep our space, wear our masks, wash our hands while we get through this vaccination process. So it would be that, just everyone continue all the good work that they've been doing, and take care of the people around them.
How about you, Doctor? What's your takeaway?
Yeah, there are some things that are going to last past this pandemic that I think are worth keeping around, such as like respecting your personal space, good hygiene, and for now at least keep on wearing masks. But once you're eligible for the vaccine, I highly recommend getting it. Obviously, I'm a little biased because I'm a doctor and I see a bunch of COVID patients. But, if you have questions, please talk to your doctor or anyone that you see for their healthcare. And I really recommend not getting information off memes you see on Facebook, Twitter, or other social media, because a lot of them have an agenda to push. Speaking to someone you trust, whether it's your doctor or other healthcare provider, or going to the primary source itself, is probably the best way to make your own informed choice.
That sounds pretty good. As a reporter, I'm always fact-checking. I spend too much time trying to fact-check memes, much to the chagrin of some folks on my own timeline. But a major thank you to the three of you for participating, and much appreciation to those of you who fearlessly ask questions in the comment section and send in videos. You can follow up on this conversation again by joining our Facebook group, NJ Pass Insiders. It is free. You just have to search it and join, and you can, get in touch with people. As always, I'm happy to share my press pass with you. That is what NJ Press Pass is all about. You're taking it and connecting with who we need to connect with, because on this show, I'm always asking your questions. So make sure you stay curious, stay healthy.